Well, I'd say a few words about neck masses, something in the neck. Um, People who have spent their whole life dealing with neck masses obviously accumulate a great deal of information. There was a wonderful clinician that years ago, that must have been 60 years ago, he'd spent his whole life and he wrote a beautiful article called The Lump in the Neck. And he just went and wrote it out longhand and it was published. It was absolutely brilliant because he was taking all these years of experience that he had and he used the word lump, which is perfect. People don't come to you and say, I have a mass in my neck. They'll say, I have a lump. Or the other common word that is used, particularly in the upper Midwest, is I have a bunch. I have a bunch in my neck. It's in northern Minnesota, Wisconsin. So, well, I think probably the most important thing is when you see someone, a whole spectrum of patients, very young to older, the main thing is it serious? Is what this person is telling me serious? And then, of course, always want to remember, no matter how I proceed, I can't deviate from getting a good history and doing somewhat of a physical exam. Because if I don't do that, I'll be lost. And the key features, I think, in the history is the age of the person, how long they've had it, and is it painful? Just simple things like that. How old is this individual? How long have they had it? And is it painful? And that alone, you get just a lot of information. But obviously, you want to ask other questions as well. Going back to the principle, is it serious or not? The thing, here again, this is just a slide that was made years ago. They forgot to put down the age and things I just mentioned, such as is it painful, and then you can ask other questions, particularly when you think of something in the neck. What does the neck do? Well, it's involved with breathing, speaking, and swallowing. So if breathing, speaking, and swallowing is also disturbed with this so-called lump, it could be quite serious. So you want to ask simple questions like that. Obviously, things such as the use of tobacco and alcohol, and if they've had other factors, trauma, and certainly irradiation could be a factor in some patients. The other one, just to repeat, is you want to remember something. Children and young adults, by far the most neck masses are inflammatory. No doubt about it. Now, you can't categorize the inflammation, but you can make that as a general statement. In children, they can be inflammatory, but they can certainly be congenital. So you have some understanding of that. And then, of course, a few that worry you. There's a few children that can present with neoplasms. They're not common at all, but they can. And some people carry this beyond. They'll say, pediatrics clear up till about 50. They would be in this category of inflammation. It changes a bit here because you don't normally see something congenital presenting at the age of 45. Then beyond 40, you always worry about that one factor that you initially present yourself with thinking, is it serious or not? Now, obviously, if you see a child with this, you would be considered foolish if you said this is a cancer. This child looks very healthy, obviously, probably a year old, and presents with this mass. Well, the likelihood of that, if the mother says, well, it's been there for the last 4 or 5 months, and I think it was there at birth, obviously should have been picked up by the pediatrician. This is most likely a lymphangioma. This very healthy looking child. You wouldn't think of something inflammatory if it's been there for months, and you certainly wouldn't think of something neoplastic, but you think it's probably congenital. And that's understandable. The main thing is don't make things complex. Try to keep them rather simple in your approach. Because if you don't, then you get off in left field, and it's not good to be in left field. It just isn't. Here's a child that presents with something right in the middle of the neck. It's been there for a long time. Child might be 3 years old. Now you might say, well, would that be cancer? Oh, it'd be extremely remote. Could it be inflammatory? Yes, but it doesn't seem to do much, and it doesn't seem to become acutely inflamed or tender. This is what they call a thyroglossal duct cyst, right smack in the midline. A congenital disturbance in a very young patient. Obviously, you can give the mother and father a little information. Those are best removed carefully.
That's done by ENT though, right?
Yeah. Mm-hmm. The secret of removing those is to make sure they don't reoccur. And the way to do that is to remember that right here is a wonderful little bone called the hyoid bone. And these travel almost invariably very close or through the hyoid bone. So you have to take out a little segment of the hyoid bone, which is in no way prevents any morbidity to the functions of the neck. It has to be removed, otherwise it'll come back. And you have to follow it clear up to the base of the tongue, which is the source of the thyroid embryologically. It comes down from the base of the tongue clear to the anterior neck. Here's a good example. Probably 8 years old, had that for years and years and years. Well, could that be inflammatory? It would be very, very remote. Neoplastic? No, not considered, particularly if it's nice and movable. This is a branchial cleft cyst. And the key there is that, think of this nice little guide here, the anterior border of the sternocleidomastoid muscle. They're usually in relationship to that, either behind it or on the edge of it or a little bit more anterior. That's a thyroglossal duct cyst. And of course it'll need to be removed. They continue to grow slowly. This is a young child. And here's a little bit older. He's probably a late teenager, early 20s. He's got this, he's had it for years. Branchial cleft cyst right there. So again, just to review, most young people, if they have a neck mass, either inflammatory or congenital. But obviously you can be fooled, but you don't completely rule things out. Say, oh, that's not in any way serious. If you see a child like this, where this develops, well, this child's doing fine until the last 6 weeks, and something blooms up like that. Oh, you'd say, well, could that be something serious, such as a lymphoma? Well, I would say that's possible. If it had not been present ever before, I don't think I'd consider this a branchial cleft cyst, but it would be in your diagnosis. But so children can have neoplasms too, but they're not common. Lymphomas can occur, obviously. Here's someone a bit older and has had this for years. And of course, you can see this is the area of the parotid, the body, and the tail of the parotid. He says, you know, I've had that since I was 10 years old, and I'm now 25. Well, it moves around. It's not in any way painful. So it's most likely a parotid gland tumor, probably benign. It's been with this fellow for 15 years. It's grown a little bit, and it doesn't get terribly painful or inflamed. Here's an older gentleman with a parotid tumor right in the body of it. This is the body, the tail of the parotid is down here. They're contiguous. It's been there for a long time. And it's now cosmetic. Someone points it out. You know, that so-called bunch in your neck doesn't look very, very nice. Could it be neoplastic? Not if it's been present for a number of years, the likelihood. Can you have malignant parotid tumors? Oh yes, but they tend to grow rapidly and involve the facial nerve. Here's a gentleman probably in his 30s and has had that for a long time. otherwise healthy, and this is part of the body of the parotid. They're not uncommon. Parotid tumors are not uncommon at all. One thing I think it's kind of good to do is, if you see someone with a neck mass, it's nice to have in the exam rooms a little plastic ruler. Measure things. Just put down the date, and I measured this. It's centimeters, 3 centimeters by 2 centimeters. Just take a little note. And I say, how accurate do you have to be? Oh, you don't have to be that accurate. Just lay it up against the mass and measure it, because that person may not see you again and just vanish. You might get a call in a year from somebody in another state. Did you see that back then? What did it measure? You look up your notes, and sure enough, there it is. You wrote down what the measurement was. Simple. It takes you 30 seconds to measure it. Why not? Obviously, you might put down such things as to its movability and all. Most things that are benign tend to move, not invariably. Things that are fixed, that's a different story. Here again, an older gentleman that has a mass, but if this gentleman says, oh, it's only been there in the last 2 months, the likelihood of it being a parotid tumor is very remote. That could be significant in terms of, and he's an individual that's probably 70 years old, and the number one thing would be neck mass, older gentleman. I've got to prove to myself as well as the patient, certainly, that this is not neoplastic. Now, going on, here's a young person with very characteristic mass in the thyroid gland. And you're going to encounter thyroid masses. They're not uncommon. You see this thyroid mass. You see it, older person with a thyroid mass, usually in the midline. They can be lateral a bit. You always remember that even in adults, you can have a relatively young person with a thyroglossal duct cyst. The thyroid is right in here. Here's the edge of the sternocleidomastoid muscle on each side. The thyroid gland hides behind that. Now, people say, should you be able to palpate every thyroid nodule? No. If you don't palpate a thyroid nodule, if it's under 2 centimeters, don't fault yourself. Even experts can't do that. Now, obviously, something over 2 centimeters in the thyroid, you should be able to feel it. If it's smaller than that and it's picked up on a scan and you say, well, I didn't feel it, well, you're not expected to feel it. You just can't. You don't fault yourself. Now, here's a nice older person. And she says, well, I've had this here the last 2 months. Would you think of a brachial cleft cyst? Absolutely not. This lady's 75 years old, 80 years old, could be as old as I am. Why would you think of something inflammatory or something that would be congenital? That'd be foolish. Why would you treat this person with antibiotics? No. I'm of the belief that this idea of treating people for 2 weeks with antibiotics to see if a neck mass goes down is really very, very marginal care, unless you really have an indication that it could be inflammatory. This would not be considered inflammatory. This individual also says they've had a little pain when they swallow, and they just feel kind of crummy. Say, oh my goodness, that is significant. That's mass. That'd be a nice one to measure. You'd measure from here to here, and from here to there. Say, well, I measured this mass. It's just anterior to the edge of the sternocleidomastoid muscle, and it measures 2.5 by 4 cm. Here's an older gentleman with a mass here at the edge of the sternocleidomastoid muscle. These masses of significance are usually behind the muscle or right anterior to it. There's a nice mass. This individual, the history, you certainly want to know if they use tobacco or alcohol, if their voice has been hoarse, if they had any difficulty swallowing. And always remember that there might be a smaller mass on this side, so if you feel one side, you want to feel the other. Obviously, an older gentleman with a big mass. And obviously, It doesn't take anyone with any great intelligence to determine this is significant. And they say it's been there for 3 months. That's why it's so important to conduct a very thorough exam in the oral cavity and the oral pharynx and the laryngeal. The source of that could be found with a simple exam. A very ominous mass in an older gentleman. I think it's right to say this is cancer until proven otherwise. And in your exam, you might come up with something like this. Look at this. Floor of the mouth, a great big cancer. Obviously, that's going to spread to lymph nodes in the neck and be something quite serious. Here's someone who's been hoarse for the last year. A normal vocal cord here, a great big cancer here. Now they present with a neck mass. And they say, I got this bunch in my neck. My voice has been lousy for a year. Well, obviously. An example. Very good. Undiagnosed neck masses in adults are cancerous until proven otherwise. And that's why it's so terrible. Don't ever do an excisional biopsy on anyone. Never until they've had a very thorough exam. And we've gotten away from excisional biopsies, which is a wonderful way of doing these fine needle aspiration biopsies. It's been revolutionary in terms of evaluating neck masses. This is a little gun we've used this several times. I think it had somewhat, but the person that stole our thunder are these wonderful interventional radiologists. They can do anything. They can use their guidance and pick up all these little disturbances and get good tissue. They use a little different needles, and they're really fussy. Some of them are meticulously fussy. So having them evaluate a neck mass, I think, is wise. Very good.